Welcome, Dr. Colin Alert. We're talking about hypertension in Barbados. We know that there's a week coming up with the Heart and Stroke Foundation, but we want to focus in on the disease of itself, and I would like you to tell us, what is hypertension?
Okay, hypertension is a disease that occurs when the pressure in your circulatory system is too high. Um, it's actually diagnosed by uh, comparing it to two numbers, um, and those numbers correspond to one, when the heart pumps out blood, that's called the systolic blood pressure, and two, when the heart is filling up, that's the diastolic blood pressure. Let me just backtrack on that a little bit. The heart is like a pump, a two-stroke pump. So it pumps blood out, fills up, pumps blood out, fills up. So when it pumps blood out, systolic blood pressure. When it fills up, diastolic blood pressure. Systolic, diastolic, systolic. If the systolic is persistently over 130 millimeters of mercury, or the diastolic is over 80 millimeters of mercury, as an adult, then we say you have high blood pressure.
What is the picture like in Barbados? Can you give us some numbers in terms of demographics, age, range, percentage of
Yeah,
the population?
the most recent data we have come from the Health of the Nation study, which was done by the Chronic Disease Research Center and Ministry of Health, and published the results in 2015. And in that study uh, of adults aged 25 and over, 42% had high blood pressure. So it's a very, very common disease. That's probably 40, 50,000 people. Sorry, more than that. No, maybe 80, 90,000 people, but 42% of adults over the age of 25, you know. Older figures from years ago suggest that by age 50, 1 in 2 adults have high blood pressure, so that's a lot, you know.
You talked about how the heart works and the circulatory system works. But what causes hypertension?
Okay, well, basically, it occurs when the heart works too hard, it pumps too hard, okay? Um, and that often in our part of the Western world tends to happen as we get older and we eat badly and we don't exercise and a few other reasons. We get too fat and so on. Okay. Now, when the heart pumps at a certain level, that's okay. But when the heart has to pump harder, that puts extra work on the heart or extra pressure on the heart. Like what used to happen with your old girlfriends when they gave pressure, the heart ended up getting bashed up, right? So very similar kind of scenario happens. So high blood pressure is one of the main contributors to heart disease in our part of the world. Also, the high blood pressure going to the organs like eyes, mash up the eyes. So high blood pressure is leading cause of blindness. High blood pressure going to the brain can cause damage to the brain, can cause dementia, it can cause strokes. High blood pressure going to the kidneys can mash up the kidneys. Another major issue. High blood pressure to the legs cause circulatory problems, which in part may contribute to some of the amputations we have, even though we think diabetes is the more major factor in those amputations. But it affects multiple parts of the body. It affects multiple people. And the trouble is, you know, it's like termites. They affect you inside and outside. You're all right, you don't feel anything until major damage has set in.
Yeah, I was listening to recently. Was watching something someone shared with me recently. Professor Sir Hilary Beckles. He's vice chancellor of the University of West Indies. He was given a lecture. And he's talking about the studies that the university has been doing, and he's talked about the historical nature of this disease called hypertension. How because of the slaves and how and their diets, that what has happened now, that there seems to be some genetic problem where has come down through the generations. Well, what is some of the research been telling people like yourself?
Yeah. I'm not active in research anymore. But yeah, there's certainly been studies which suggest one, for example, uh, we black people end up with more high blood pressure than non-black people. Okay, um, but is that part of it is also related to obesity? Now, when you're fat, your body can store food. Okay, back in way back 200 years ago when we all lived in Africa, you know, when you didn't have fridges, people went hunting, and when they get good food, they bust it up. And then when they can't get something, they starve a little bit, but because they had good stores, they would survive. So those who could store food well survive better. When we came over to the Caribbean and a couple of years or decades passed, and we had fridges and, we had food all the time, so we bust it up. And then so we have significant obesity figures, right? And then also we have significantly high blood pressure figures to follow, right? There was a study called IPSTAGE, International Collaborative Study of Hypertension in Blacks, which looks at blacks in Africa, look at blacks in 3 West Indian countries, Jamaica, St. Lucia, Barbados, which looks at blacks in Manchester, England, and which looks at blacks in Chicago, okay? And going from Africa to the Caribbean, to Manchester, to Chicago, you had little blood pressure in Africa, a little more in the Caribbean, a little more in Manchester, lots more in Chicago. And that followed the exact pattern with obesity. Hardly any in Africa, some in the Caribbean, and Barbados leading those group of countries, more in Manchester, most in Chicago. So the more food people had access to, the more obesity set in, okay? In this study, of course, since it's the same African people, the genes are the same. So you can't say necessarily it's a genetic thing, but the environments were different, and the environments they contributed to it. So there's both a genetic and an environment, but that particular study kind of sorted out the genetic part of it and just looked at the environment.
Being someone who's hypertensive myself, I know that there's a lot of treatment, and there's always a lot of debate about how you manage it. Could you share a little bit about the treatment and management of it? Some patients want to come off their meds and stuff like that. How do you manage that whole situation?
Yeah. Well, first of all, the sort of important steps in hypertension is the education, it's your diet, it's your exercise, and it's your medication. And you certainly need at least 3 of those. Some people need medication as well, quite a lot, unfortunately. Okay, you need to educate yourself about hypertension, what it is, okay, and what it can do. Right? Most people don't realize that hypertension can cause heart disease, it can cause strokes, can mash up your kidneys. So the education part of it is important. We encourage people to do self-monitoring of their blood pressures, so you can see what your pressure is, know what it should be, and that kind of cues you in as to, look, my pressure reading too high, I need to do something about it. Pressure reading all right, okay. Diet. The main dietary component with hypertension is salt, and as people, we eat too much salt, too much salty foods, okay. We eat too much in general, but too much salt specifically, okay. As people, we don't exercise enough. We've gotten lazy, okay. The American College of Sports Medicine suggests that for adults should get at least half an hour of exercise per day, 5 days a week. If you get more, that's even better. But that's sort of the minimum amount to maintain good health, okay? But I mean, in the Health of the Nation study suggests that 75% of adults above the age of 35 don't get this level of exercise. So as a nation, we certainly have to be considered lazy, okay? So we don't get the exercise, we eat badly, we on seafood diets. We see food, we eat it, we eat, right? We don't exercise. And that's in part why a lot of us then have to end up on drugs. Now, there are many different classes of antihypertensive drugs. You know, Generally, most of them work very well. Uh, Obviously, as with any other medication, a few people may develop a side effect of one or the other, but that per se is not a reason for them to stop taking it. That's a reason for them to talk to their doctor, change around the medicine, find something else, as well as do the other things to maintain their health. Keep up the exercise, keep up eating properly, and so on.
So as we close here, just a final word. What would your advice be to persons, people out there who are hypertensive and about what they do, how they're managing it, even those who are not, who have not been diagnosed with hypertension, and what can they do to prevent and make sure that they don't fall into this category?
Right. Well, the healthy lifestyle is the common thread, whether you have hypertension or not. And that thread includes careful what you're eating, don't eat too much, right? Don't eat the seafood diet, as I mentioned before, okay? Um, Beware salt and salty food, salt fish and pigtail and salt meat and bacon and ham and all those salty things, okay? Beware salty foods. Um, don't overeat, because obesity is a major issue. And if you are obese, then certainly work with your doctor or whoever else, your family members, to try and reduce that weight. The heavier you are, the more pressure that puts on your heart, the more likely you are to develop high blood pressure, the more likely to damage the heart and end up with heart problems. So overweight is critical in this. Control the weight, and you have a much better chance of not having high blood pressure. So it's the diet, the exercise, the monitor for adults in our part of the world, the self-monitoring of blood pressure, okay, and then following the advice of your healthcare professionals, doctors, dietitians, exercise physiologists, and others.
All right, thank you very much, Dr. Colin Alert.
Thank you.